If you are over 60 and you are taking amlodipine for your blood pressure, what I am about to tell you in this video could save your life. My name is Dr. Robert Vance, and I have been a cardiologist for over 20 years. Today I'm going to share something with you that most doctors will never tell you about one of the most popular blood pressure medications in America. And I am not telling you to stop taking your medication without talking to your doctor. That would be dangerous. But I am telling you that there is information you need to know that your doctor probably did not share when they wrote that prescription. Let me start with a story. An 82-year-old patient of mine, let us call him Robert, came to see me after being on amlodipine for about 8 months. He was taking 5 milligrams once daily, which is actually a very standard starting dose for seniors. His blood pressure had come down nicely from 165 over 95 to around 130 over 80. His doctor was happy. Robert was happy. But Robert had a problem. Over those 8 months, he had gained nearly 15 pounds. His ankles had swollen up so badly that he could not wear his regular shoes. He had to buy slippers 2 sizes larger just to walk around his house. He felt tired all the time. He could not catch his breath after walking up a single flight of stairs. And his wife noticed that he seemed confused and forgetful, which was not like him at all. Robert thought all of these symptoms were just part of getting older. He thought the weight gain was because he was not exercising enough. He thought the swelling was because he was on his feet too much. He thought the fatigue was just normal aging. But here's the truth. Every single one of those symptoms was caused by his amlodipine, and his doctor had never warned him about any of them. Let me explain what amlodipine actually is and how it works. Amlodipine belongs to a class of drugs called calcium channel blockers. It was first approved by the FDA back in 1987, and today it is one of the most prescribed blood pressure medications in the world, with more than 40 million prescriptions written annually in the United States alone. The way amlodipine works is by relaxing your blood vessels. It does this by blocking calcium from entering the smooth muscle cells in your artery walls. When those muscles relax, your blood vessels widen and your blood pressure drops. On paper, this sounds great. And for many patients, amlodipine does a perfectly good job of lowering blood pressure. But here is what your doctor may not have told you. Starting with the most obvious side effect that affects nearly 1 in 3 seniors who take this medication: peripheral edema. That is the medical term for swelling in your ankles, feet, and lower legs. The official prescribing information from the FDA acknowledges that edema occurs in a dose-related manner. At the standard 5 milligram dose, about 3% of patients experience edema. But at the 10 milligram dose, that number jumps to nearly 11%. And here's the kicker. Those numbers come from clinical trials that mostly included younger, healthier patients. In real-world practice with seniors over 65, the rates of edema are significantly higher. Why does this happen? Because as we age, our bodies do not clear amlodipine as efficiently. The FDA itself states that elderly patients have decreased clearance of amlodipine with a resulting increase in exposure of approximately 40 to 60% compared to younger patients. That means the same dose that works for a 40-year-old can be effectively a much higher dose in a 75-year-old. I have seen cases where the swelling becomes so severe that it looks like something out of a medical textbook. There is a documented case report from the medical literature about an 82-year-old patient who developed swelling so extreme that it spread from his legs to his entire body, causing fluid to accumulate around his heart and in the space around his lungs. That patient required hospitalization and a complete change of his medication regimen. Now, I am not telling you this to scare you. I am telling you this so you know what to watch for. But the swelling is not even the most dangerous side effect of amlodipine in seniors. Let me tell you about another patient of mine, a 74-year-old woman named Margaret. Margaret had a history of mild heart failure. Her heart was not pumping as strongly as it should, but she was managing well with her current medications. Then her primary care doctor prescribed amlodipine for her blood pressure. Within 2 months, Margaret was in the hospital struggling to breathe. She had developed pulmonary edema, which is fluid buildup inside the lungs. Her heart failure had worsened significantly. The prescribing information for amlodipine contains a very specific warning. Calcium channel blockers, including amlodipine, should be used with caution in patients with congestive heart failure, as they may increase the risk of future cardiovascular events and mortality. Let me read that again for you. May increase the risk of death. That is not my opinion. That is written in the official FDA-approved label for this medication. A study published in the Journal of Clinical Hypertension in 2023 reviewed the evidence for amlodipine use over the past 30 years. The authors noted that while amlodipine is effective for blood pressure control, side effects including edema, palpitations, dizziness, and flushing are more common with the higher dose of 10 milligrams. And for seniors, even the lower dose can cause problems because of that decreased drug clearance I mentioned earlier. There is another side effect that almost nobody talks about, and it is one that can be especially dangerous for older adults. I am talking about dizziness, lightheadedness, and an increased risk of falls. The FDA prescribing information lists dizziness as a common side effect of amlodipine, occurring in up to 3.4% of patients at the 5 to 10 milligram doses. And for seniors, a single fall can be life-changing. A broken hip at age 75 often leads to a cascade of complications: blood clots, pneumonia, loss of independence, and in too many cases, death. Your blood pressure medication should not put you at risk of falling in your own home. Let me also talk about something that happened to Margaret that I mentioned earlier: the confusion and forgetfulness. Amlodipine is listed as having psychiatric side effects, including mood changes, anxiety, depression, and insomnia. One of the sources I reviewed specifically notes that elderly patients may be more susceptible to these neuropsychiatric effects. When Margaret finally came off amlodipine, her confusion cleared up within 3 weeks. Her family told me it was like getting their mother back. Now, I want to be very clear about something. I am not saying that amlodipine is a bad medication for everyone. For many patients, especially younger patients without heart failure, amlodipine works very well and causes minimal side effects. The same 2023 review I mentioned earlier confirmed that amlodipine is a wise choice for older adults due to its ability to control blood pressure and protect against stroke and myocardial infarction, but it must be used carefully. The key word here is carefully. The FDA explicitly recommends that for elderly patients, dosing should start at the low end of the range, typically 2.5 milligrams instead of 5 milligrams, because of that decreased drug clearance I mentioned. But how many of you watching this video were started on 5 milligrams right away? How many of you were started on 10 milligrams? If your doctor did not start you at the lowest possible dose, they were not following the official prescribing guidelines for geriatric patients. So, what should you do if you are over 65 and taking amlodipine? First, do not stop taking your medication. Stopping a blood pressure medication suddenly can cause a dangerous spike in your blood pressure that could trigger a heart attack or stroke. That is a medical emergency waiting to happen. Instead, here is what I recommend. Number 1, look at your ankles tonight before you go to bed. Press your finger into the skin over your shin bone for about 10 seconds. If it leaves a dent, that is called pitting edema, and it is a sign that you are retaining fluid from your amlodipine. Show that dent to your doctor. Number 2, if you are experiencing any of the symptoms I mentioned today, fatigue, shortness of breath, dizziness, confusion, ankle swelling, make an appointment with your doctor specifically to discuss your blood pressure medication. Do not just mention it as an afterthought. Say these exact words: I think my amlodipine might be causing side effects and I want to discuss other options. Number 3, ask your doctor about alternative medications. There are many other blood pressure medications available that work through completely different mechanisms. ACE inhibitors like lisinopril, ARBs like losartan, thiazide diuretics like chlorthalidone. These medications do not cause the same kind of fluid retention that amlodipine does. And for seniors, the American College of Physicians and the American Academy of Family Physicians recommend a target systolic blood pressure of less than 150 for patients over 60, not the 120 that you might have heard about. That higher target means you might need less medication in the first place. Number 4, if you have any history of heart failure, ask your doctor specifically why they chose amlodipine for you. The official prescribing information contains a black box warning equivalent statement about the risk of worsening heart failure. If your doctor is not aware of this risk, you need a new doctor. Let me leave you with this. The goal of treating high blood pressure is to help you live a longer, healthier life. But if the medication you are taking is causing swelling, fatigue, falls, or confusion, you are not living a healthier life. You are trading one problem for another. Medicine is about balance. And when it comes to amlodipine in seniors over 65, that balance is much more delicate than most doctors acknowledge. Thank you for watching. I am Dr. Robert Vance. If you found this video helpful, please subscribe and hit the bell icon so you never miss a video. I post new heart health research for seniors every single day. And watch this video next, where I reveal the one blood pressure number that matters more than your top number. Your heart will thank you.